So here you are watching coblation adenoidectomy in a 6-year-old child with obstructive symptoms. You can see they are grade 4 adenoids. I have already performed intracapsular tonsillectomy. Now I'm starting the adenoid from the superior pole. That's the superior boundary of the adenoid, which is the periosteum below the sphenoid bone. Now I'm debulking the adenoid tissues layer by layer so that I can define the whole superior boundary, which is the periosteum below the sphenoid bone. Now, as I have debulked, I have got some space and I can see things in a much better perspective. So, important is not to open up the periosteum, only define the periosteum, not to open it up. So, now that superior boundary is completely defined, now we go for the lateral boundary. This is the eustachian tube orifice, this is the torus tubaris, and the lateral boundary anteriorly is the tubal tonsil or torus tubaris. So, I am removing the lymphoid tissues, sparing 5 millimeter from the eustachian tube orifice. I am removing all the lymphoid tissues, but I'm not getting into the muscle. So this is the lateral boundary anteriorly. Make sure that you do not damage the back surface of the soft palate. And now the the lateral boundary posteriorly is the fossa of Rosenmuller. So that's the fossa of Rosenmuller. From here, we go into the fossa of Rosenmuller and completely eliminate the tissues from the fossa of Rosenmuller. Now, unless I debulk, some saline please. Unless I debulk, I'll not be able to see things. Thank you. You don't need to bring your scope, take your scope in and out, but you can actually simply ask the nurse to pour some saline. You can see I have ablated the superficial tissues. Now I am getting into the fossa of Rosenmuller. So complete removal of tissues from the fossa of Rosenmuller is important so that there is no recurrence. That is our lateral boundary posteriorly. This is the lateral boundary anteriorly. Let me debulk some more tissues so that I can clearly define the boundaries on the posterior and the lateral aspects. And you can see how much of lymphoid tissues were blocking the nasopharynx. And it is impossible for the child to breathe with such a blockage. And all those changes in facial profile happens because of this blockage. Now I am in the extreme posterior aspect. That's the fossa of Rosenmuller. I am removing tissues from the fossa of Rosenmuller. Let me just stop this bleeding over here. And very soon I'll show you the fossa of Rosenmuller and the buccopharyngeal fascia very clearly, which is the posterior boundary. That is the fossa of Rosenmuller. And you can see that almost every bit of lymphoid tissues are removed. Now I'm going for the posterior boundary, which is the buccopharyngeal fascia. Can you see the buccopharyngeal fascia? That is my posterior boundary. I'm not supposed to open it up, I'm only supposed to define it. If I open it up, muscles will be exposed and the child will have pain on lifting the head. So that is the buccopharyngeal fascia, which is the posterior boundary. This is the fossa of Rosenmuller. And then I will come to the inferior boundary, which is the Passavant's ridge. You can see the adenoids are ending over here. That is the inferior boundary. And that's the Passavant's ridge. You'll see the contraction, the horizontal contraction in a moment. Now you can see the torus tuberous. Still there is some amount of lymphoid tissue. Alright. And that's the Passavant's ridge area. That's the Passavant's ridge area. Still some amount of lymphoid tissue is hidden. Let me see what's trickling from there. Alright. So there's hardly any tissue left over here. And you can see the my wand, first wire is completely gone, the second one has become thin. And therefore it's not working so well. So I'll require to change the wand to go on to the left side, and therefore the hemostasis is not so good. But anyway, the right side work is over. These are the boundaries of the adenoid surgery. Superiorly, the periosteum below the sphenoid bone. Laterally anterior is the torus tuberous. Lateral posterior is the fossa of Rosenmuller. Posteriorly is the buccopharyngeal fascia. Now you see this wand has stopped working, so I'll have to simply change this wand. And inferiorly is the Passavant's ridge. Thank you for watching.